Good morning. Welcome. It's Thursday, April 22nd, and you are with us at The Doc is In Ask Dr. Arwady. I'm Sybil Madison, your Deputy Mayor for Education and Human Services. Very happy to be back with Dr. Allison Arwady.
Good morning.
She's your Commissioner for the Chicago Department of Public Health. This is where you can get all your questions answered about COVID-19 and the vaccine. And we'd love to get those questions from you. You can put them in the chat box below. You can also send them to us using the hashtag AskDrArwady through Facebook or Twitter. As usual, we're going to check our distance.
We're good. We're also vaccinated, but we are still good. We wear our masks.
That's right. That's right. Even though we're both fully vaccinated, we're still doing all those things that we need to do to protect ourselves and others. You want to jump into the data?
I do. So as always, chicago.gov/coronavirus. That's your one-stop shop for everything related to COVID in Chicago. And if we go to the dashboard, you see continued good news here. So our positivity rate right now is at a 5.4%, down from 5.8% a week ago. Our testing volume actually remains very good. We're doing almost 14,000 tests a day, well above what we need to, and down just 3% from a week ago. And then our cumulative cases are at 631, down 13% from a week ago when we were averaging 726. And really the most important thing here is the direction that we're moving. The main indicators that we've been looking for is stability or decline across all of these. So those case rates are still higher than we'd like them to be. Ideally, we want to get that back down under 400 and eventually back down under 200. We want to get that positivity down under 5%, but continued progress in the right direction is what is going to let us move toward reopening. And I'm feeling, even more reopening. And I'm feeling optimistic that, even we're coming up on an incubation period. We're not far from that. And so I'm hopeful for some good news there as soon as next week. So thank you for everything that you're doing. Those of you who are getting vaccinated, first and foremost, that's the most important thing that you can possibly do to drive those numbers down is get vaccinated and make sure everybody is getting the facts and getting vaccinated. But then secondly, continuing when you're out in public, wearing those masks, doing the distancing, everything that has gotten us this far. And, it's interesting, because, like, someone was asking me about, how worried am I about people in restaurants, right? And it all depends on whether people are vaccinated. If I've got a restaurant that's relatively full, but everybody in it is fully vaccinated, that's a pretty low risk setting. Whereas if you've got a restaurant that may not be as full, but nobody's vaccinated, it's actually still quite high risk given how much COVID is in Chicago. And so there's this new sort of metric that's happening that as we're making some of this, some of these decisions, vaccine is playing a really different role, and we're seeing we are up still in our hospitalizations and our ICU, but nothing like we saw in either of the first two surges because of vaccination. Vaccine has been really protective for so many people who have gotten COVID in this third surge against the more severe outcomes, the hospitalization and the death.
And I think that's an important part of the story that I don't know if we're talking enough about, that there's actually data that can show that the cases are going down in places where we have a lot of vaccination, and that the people who, I'm thinking about our congregate settings where we're keeping close track, right? And where we are seeing cases, it's more than likely people who did not get vaccinated. And so I think, I know people, may wonder about the effectiveness of the vaccine, but we actually have data now that we can look at that tell us, local data, that the vaccine is having an impact.
Yeah, that's right. And actually just yesterday there was what's called an MMWR, Morbidity and Mortality Weekly Report. It's sort of the weekly journal that the CDC puts out. And just yesterday there was data from Chicago about nursing home cases.
I did not know that.
Yes, skilled nursing facilities. We've got 78 of them here in Chicago. We've had an enormous effort from the very beginning, lots and lots and lots of testing. And it was really highlighting, first it was looking at this potential for breakthrough infections, right? And really highlighting that, but the main graphic in there was showing as as vaccine came in, just how much lower those cases have been, and that by far the huge majority of cases that we've seen or continue to see have been in people, residents and staff, who did not choose to get vaccinated. But we also delineate out a total of 22 cases that have been seen in that setting that are breakthrough cases, meaning people fully vaccinated. Most of those people were asymptomatic, meaning they didn't have symptoms at all, but because we're still doing a lot of testing in these high-risk settings, we were detecting that they had COVID. Importantly, we saw no spread where somebody did have a breakthrough case, because we know that people, if you're vaccinated, the level of virus, and the great majority of people, to be very clear, when you're vaccinated, are then you're very protected against COVID, but the vaccines are not 100%, right? With Pfizer and Moderna, they're in the 90% plus range, but that's not 100%. And so in high-risk settings like nursing homes, it's one of the reasons we really have been trying to push very, very high vaccination levels. But there is a chance, and we did see 22 cases of these breakthroughs. And because these are people who are really sick, we did have, 2 people who were hospitalized and 1 person who died. That person did have other infections going on and had a lot of comorbidities. But the big story was that mainly the huge majority of the infections, there were about 600, and I think we'll post the link to it online, but there were more than 600 infections kind of over this time period, the great majority of which, were in people who were not vaccinated. And continually, where we are seeing cases in those settings, the huge majority of the time, it's people who didn't choose to get vaccinated. Yeah. So, yeah. See, you were timely in your comment.
I had no idea, Dr. Arwady.
Yeah. So I also want to, maybe before we jump into questions, I want to just make sure people are hearing some exciting news related to vaccine availability. Because really, for the first time, the time has come. For 4 months now, we've been saying it's coming. Soon you are going to be able to find a vaccine if you want a vaccine. But our supply has just not been up to our demand month after month after month. And I know how frustrating that has been for many people. But as of now, we have enough vaccine.
Yay!
Yay! Last week was
that's even with the pause in the J&J.
That's even with the pause in the J&J. Even with the pause in the J&J, what we've seen, and there's a few things that are accounting for this. One is that demand has really softened, leveled off, especially in some other parts of Illinois and really across the U.S. And so, we were hearing over this last month or two, right? Indiana saying, we've got plenty of vaccine. Chicago, come on over. In downstate Illinois, plenty of vaccine. And I know a lot of Chicagoans that had the means to travel went and got vaccine. In that softening of that demand, there has been more openness to putting vaccine in Chicago and in the Northeast. So I think the state has directed a lot more vaccine, not even just Chicago, but in the Northeast generally, which has helped a lot. And at the federal level, they've been directly providing vaccines to a lot of the pharmacies and to the federally qualified health centers. Here in Chicago, we have a lot of federally qualified health centers. Those are the primary care centers. They're so important. There are public clinics that we love them that serve people, especially people who may be uninsured or lower income. Absolutely critical partners in terms of everything we've done in COVID. And this week, the federal government said to all of the federally qualified health centers, basically, you can get as much vaccine as you would like. You can have 100,000 doses of vaccine if you would like. And a lot of our vaccine, Chicago's vaccine, has been going, to those federally qualified health centers, to some of the pharmacies, and so it's given us more flexibility. And then the state did also, let us have some vaccine directly. And so the good news, and I really want people to hear this, is if you want a vaccine in Chicago, you can absolutely get one. You can get one today.
No excuses.
No excuses. So let's take a quick look. Actually, I pulled up on ZocDoc. As a reminder, ZocDoc.com/vaccine. This is where you should go to find sites. And just 5 minutes ago, I pulled this up. And remember, we're open to everybody 16 plus. And you can see at the United Center, we've got appointments available today. There's, let's count them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 settings across Chicago that have vaccine eligibility.
Today?
Looks like, let's see, the United Center is today. We've got Instavax, Esperanza, Chicago State University, Holy Cross Hospital, Roseland Community Hospital, St. Xavier University Health Center,
over the city.
Chicago Family Health Pullman are all available today. We've got, looks like tomorrow we've got at Richard J. Daley College. On Friday we've got appointments at Wilbur Wright. Sunday at Apostolic Faith Church. And these are open to anybody who lives in the city of Chicago. If you are finding an appointment on ZocDoc, you live in Chicago, these are open to you. So first of all, really good news there. So I don't want to hear, I can't find a vaccine. ZocDoc.com is an obvious place, and I'm showing you right now there are appointments. So please let people know if they were waiting for some of this to calm down. And this is what we've said, that everybody would probably be able to get a vaccine, in April or kind of into May, and we really are there. The other thing I cannot say strongly enough, and I want people to pass this on, is that our call center remains open and can hook anybody up to vaccine appointments really across the city. So 312-746-4835. That is where we want you to call. We want anybody to call who doesn't handle the internet. Lots of people working to make sure people can get connected. And in addition to some of these larger sites that are available on ZocDoc, we've got lots of community-based sites. We've got things, with our ongoing faith initiative. We've got some more focused places that are only open to people who live in certain neighborhoods. But if you call the call center, they will get you hooked up with vaccine
hookups.
Vaccine hookups, that we've got them. And then two other just announcements is that first, really as of today, all of the City of Chicago pods are open to 16 and 17-year-old Chicagoans. And for some context on this, as a reminder, the Pfizer vaccine is the only vaccine that has the emergency use authorization for 16 and 17-year-olds. So children under 18 cannot get the Moderna vaccine. They cannot get the Johnson & Johnson vaccine, even if it does come back online. Pfizer is the only one that 16 and 17-year-olds are authorized to get. So our pods are now, at this point, sort of back to using Pfizer pretty much entirely right at the moment, partly because J&J is on pause and a few other changes. So in that setting, we are open to 16 and 17-year-olds. However, you do need to have a present parent or guardian who needs to sign that you are allowed to get the vaccine unless you are emancipated or married, in which case a 16 or 17-year-old would just need to bring some documentation of that. But please, we've already had availability for 16 and 17-year-olds through pharmacies and through hospitals and offices, but we are now really immediately making availability for 16 and 17-year-olds in all of our pods, and that does include the United Center. So that's good news. And the other exciting announcement is that beginning tomorrow, because we are seeing so much availability, we are opening City of Chicago pods to some walk-up availability. We still encourage people to make an appointment. That's going to be the best way. Go on ZocDoc or call the call center. If you make an appointment, you won't need to be standing in long lines. You know for sure you have an appointment. It really remains the best way to make an appointment. But we know that a lot of people are still having, challenges getting appointments, and we know there's digital divides, and we know there's people who maybe spur of the moment might say, let's get a vaccine. And so we will be opening up a certain number of doses at all of our sites for walk-up. Once we run through those number of doses for the day, that will be what's available. And once we get a sense of supply and demand, we'll be able to give a little bit more information about what those numbers will be. But it is really exciting because the possibility, and this really, we've talked a lot about when there finally is enough availability, this is going to feel more like getting a flu shot. You don't fight the crowds to get a flu shot. You can walk into your pharmacy. You can get an appointment through your doctor. The City of Chicago stands up flu vaccination clinics. We work with aldermen. We work with all sorts of partners. And it is more about there being enough vaccine and you having the confidence and making the decision to get it. So we're so excited to be in this space. We've been talking for months that these vaccines are safe, they are effective, and now we can say they truly are available for all. So please do spread the word. word about that. We've got more than half of Chicago adults have now gotten a first dose, and more than a third of Chicago adults are fully vaccinated. But we still have a long way to go. And so when we think about,
this is a big part of getting back to all those things.
It's a huge thing. It is a huge thing.
Haven't been able to do for such a long time.
That's right. That's right. I'm curious, actually. You know, when you're talking to people about making that decision to get the vaccine, what are you telling them? This is a conversation I've been having with lots of people around Chicago, actually.
Yeah. Well, I start by saying it's absolutely safe.
Yep.
And I'm confident and I trust it.
Yep.
And then I talk about all the things that I can do now that I couldn't do before. I can go visit my family. My parents live and my brother and my sister-in-law live in Ohio.
Yep.
And so it was always like, I can't see them, or I have to look at the travel order and decide whether I can go and do the quarantining.
That's right.
So that's awesome. It's been great to be around, you know, friends who are fully vaccinated and just be able to hang out.
Yep.
You know, mostly indoors, but, you know, and have a little bit more freedom.
Yeah.
So all of those things. But, you know, I also just feel like I'm making a contribution to the city's safety.
Yep.
And the bigger picture of what it means for, you know, most of us to be vaccinated.
Yeah.
So the other thing that I think is really important is, you know, people have to make that decision for themselves.
That's right.
And so I like to have conversations with people about what it is they're concerned about, what they're worried about, what they're fearful of. I think we have to have those conversations and let people express that and ask their questions, and then, you know, and then have that conversation again.
Exactly.
And again and
I love
again.
That. Yeah.
So that people can build up that confidence to take their turn.
Yeah,
so.
Yeah, I love that. And I think you're hitting on a lot of what we know are the, you know, the best practices in terms of, you know, I hope if you're vaccinated, you are talking to people, maybe even people who you don't know. You know, you're at the store, you're, you know, acquaintances, this conversation of like, you know, which one did you get? Are you vaccinated?
Right.
This sort of normalizing of getting the vaccine, and then recognizing that there are people who still have a lot of questions, and that's great. We welcome questions. I really like the opportunity to help dispel misinformation. I know there is a lot of misinformation out there, particularly online. And if you're seeing things that you're not sure about, you know, I'm happy to address that. But I think at some level, even more than the information, it's just about feeling that there are people who I know personally who have made that decision and why. And I think, you know, with my own patients, for example, when I'm seeing patients in clinic, I will often try to tie my recommendation that they get a vaccine to something about their life, right? Like if they have a child who can't yet be vaccinated, or you know, there's someone who's immunocompromised and they're really worried about, or if they themselves have serious underlying conditions, right? They have diabetes, they have heart disease, you know, it is a no-brainer from a scientific perspective that clearly, you know, they should get a vaccine. But it's not about saying you must do this. It's saying, what are your concerns? What are you thinking? Let's have this conversation again, and then saying, you know, part of this is I care about you too, right? And so even, you know, outside the doctor setting, it's like I care about you getting this vaccine. Here's why I did it, and people will have different reasons for why they make that choice. But yeah, it's one of these. If you don't do it for yourself, you do it for others. And if there's not others in your orbit, you also are very much doing it for Chicago. Like getting everybody vaccinated is how we get past COVID. It is how we reopen broadly without worries for seeing surges, and that's all we want at the end of the day, you know.
Yeah.
So
yeah, I look at the daily mortality numbers.
Yes.
And, you know, even though we're down to 4, I think, like we just have to get to 0.
We do.
We have to get back to
That's
0.
right. I mean, every single day, you know, right. I mean, Sybil's on the calls where every single morning we go through these statistics, and we're averaging 4 deaths a day right now, every day from COVID in Chicago. And a good number of those are among younger Chicagoans. Because we are more vaccinated in the older group, we've seen how important that vaccine is to protect older Chicagoans. But where there are working age Chicagoans who are not yet vaccinated, we're seeing folks getting hospitalized, and we're seeing people die. And, you know, I think particularly, you know, it's been interesting on the far south side where our vaccination coverage is not as high. We're not seeing as high in terms of people having gotten vaccinated just yet. It's also where we're seeing surges in hospitalizations and deaths to an extent, and those are preventable. And so, you know, this thing of I do it for myself, but I also really want to encourage anybody I know. And the last thing I'll say, and then we will take questions, is just I want people to really think about this vaccination effort as like not just about my decision, but about the decision of people in my family or in my neighborhood. And so part of the reason why we decided to go ahead and move to 16 and 17-year-olds in our pods, even though operationally it's a little trickier with the sign, you know, is that we would love 16 and 17-year-olds to say, let's bring mom, let's bring grandma, let's bring the next door neighbor. Everybody 16 plus is eligible in Chicago. Make it a family affair, please. And we're still lagging on our 65 plus coverage. I want to be honest about that. All the rest of our data looks good. We're, you know, ahead of where the country is. We're broadly ahead of where most other cities are. Although we're lagging somewhat still related to coverage among Black Chicagoans, we're still doing better than most other cities. Our coverage among Latinx Chicagoans is great, thanks to so much work on the ground. We still need to catch up. There's still a little bit to go there, but it's looking good. The thing we are still lagging on is 65 plus. And so if you know anybody over 65, please reach out to them. Offer them a ride. Say, I'm going to go get vaccinated.
Hold their hand when they're getting their shot.
Yeah, make it a little bit of a party. You know, you get the shot, you know, you're doing something else that's sort of fun that day. Make it a thing about connection.
Yeah.
So, all right.
Let's get to questions.
Let's get to questions.
Sorry.
Yeah. I don't know if anybody's got questions about the new at-home COVID tests, but we can take those too if people have questions.
Not yet. I'm going to start with Faye State. I haven't been here a while, so I'm going to start with Faye. Question about United Center.
Sure.
Will United Center still have a drive-through for first vaccine doses? When can appointments be made if it is still available? Many people prefer it for a number of reasons, including mobility issues.
Yeah. So as I think folks know, tomorrow is when the ACIP, the Advisory Committee on Immunization Practices for the CDC, will be meeting in an all-day meeting to make a recommendation related to the Johnson & Johnson vaccine. We really like the Johnson & Johnson vaccine for drive-through. We like it for a lot of reasons, and we are waiting to hear what the decision is on J&J. But regardless, I do expect that we will bring back some additional drive-through opportunities. It may not be until May. We're working on this walk-up and kind of getting some of that going. But we hear that there are people who really like that drive-through option, and it is something we intend to bring back, but it might not be, you know, it's not going to be today. There's a lot of moving pieces with some of these changes in what's available for vaccine and some of our operations. So as of right now, the sign-ups are for the walk-up, but we do intend to bring back additional drive-through if we're seeing demand for it.
Got it. Speaking of J&J, Denise Sims from Facebook. For women who experience blood clots during their menstrual cycle, should they get the J&J vaccine?
Yes. So when women have blood clots in the menstrual cycle, that is not abnormal. That does not signal any increased risk of clotting, and there is nothing physiologically different about that. So I would not see someone having, you know, blood clots related to menstruation at all as a contraindication, meaning you shouldn't get the J&J vaccine. Again, I do want to see what the ACIP comes out with tomorrow related to recommendations. The European Union did give the green light to the J&J vaccine, just with some additional labeling around, you know, possible very, very, very low likelihood, low risk for this side effect. And really, for me, the main piece of this is making sure that doctors know what to look for and know how to treat in the very unlikely event event that this were to happen. But no, I would not say somebody who has blood clots, meaning in their menstrual period, would have a contraindication. I think it's possible that if you are somebody who has had a history of blood clots in the past, the doctor might not recommend Johnson & Johnson for you. But even that, we're going to wait and see what the formal recommendations are from the ACIP.
Yeah, and again, because we probably can't say this enough, there were like 6 cases out of
about almost 7 million. And even with this announcement, I've been watching this pretty closely. There have been just a couple more reported. I think it's less than 10 total, though, at this point. We'll get the readout on that tomorrow at the meeting. But this did not trigger a huge surge of reports that people had not recognized or anything like that. Clearly, literally a 1 in a million type chance of this. Better chance of getting hit by lightning than of having this particular side effect. But particularly because doctors, in the very unusual event somebody had this side effect, they do need to do an extra test and look at the platelet level. They want to ask about that history. And then if someone is having a clot in that setting, you need to treat it differently. You wouldn't give them heparin, which is the traditional treatment for a blood clot that is not immune mediated in any way. So my feeling is that the main reason they did this was to make sure there was very good awareness about this in the medical community. But everything that I've seen really continues to suggest that this vaccine is very safe and we know that it's effective. So we're going to wait and see what the formal guidance is, but I am anticipating that it will likely get the green light to go ahead, and we of course will share all of that information with you. I do think it's important, though, people will continue to have options. We're going to continue to have publicly available Pfizer. We may end up doing a pod site related to Moderna. Right now, just for a reminder, Pfizer is the one that requires ultra cold. There's more complications when you mix it up, and you only have 5 days from when you pull it out of the ultra cold to use it. So it is a much more complicated vaccine to use. Moderna, you have 30 days from when you pull it out of the freezer, and then Johnson & Johnson is much easier. And so we really are trying to get Moderna to our outpatient settings, right? To the doctor's offices and the other settings, because they don't have the ultra cold storage. But depending again what availability looks like, we may have that one available. But I want people to know clearly, and you see when you go, like on the United Center, it says residents of Chicago, Pfizer. Like we're being clear at all of the City of Chicago sites which vaccine is on offer, and we will continue to doing that, even if, and I hope it will, Johnson & Johnson comes back.
Yeah, and when we have a lot of supply, you can have these choices.
I know, isn't it great?
I also just think it's reassuring that the vaccine's being tracked this closely.
That's right.
That there could be a pause made.
Yeah.
That means that people are watching what's happening, and
that's right. That's right. This is, there has never been a vaccine with this amount of scrutiny in a good way, I think.
Yes.
Like these are the after a vaccine gets that emergency use authorization, they continue to follow people in the trials, but there is a lot of follow-up related to people who are getting vaccine in the real world. We're up to almost 220 million Americans have gotten, that first dose at least of the vaccine, and not seen, just to be very clear, no signs of this problem, because of course they've gone back and looked for it with Pfizer or with Moderna, and the chance is just so low, really, with the J&J. Many, many more women getting blood clots if they have COVID than if they get this vaccine. So the risk benefit ratio is really quite clear to me. So we will see what the formal recommendations are, but I'm feeling optimistic it will come back.
All right, and I suppose that those of us who want to geek out can watch that.
You can. It is live. It is live streamed, and you can watch it. CDPH will be watching it. You can too.
So Alexandria Deanne from Facebook, hearing so many reports on the COVID arm, herpes outbreaks and intense menstrual cycles after vaccination, but these aren't listed under possible side effects. Do you have any guidance on that?
Sure. So a couple things on this. One is that there is a lot of post-vaccine, 220 million Americans have gotten a first dose of vaccine, right? So among 220 million Americans, there are people who will have a herpes outbreak, who will have a change in vaccination cycle, et cetera. What has been interesting, I think, is that this has really raised some awareness for wanting to make sure that we're asking questions about things like changes in menstruation, right? Mm-hmm. Most trials in general, actually, unless they're really focused on women's reproductive health, may not even ask questions like that. And that perhaps points to some biases in terms of how, trials in general for medications, et cetera, are set up. I have not seen anything, to be very clear, that suggests that there is any concerning side effect in a way that would last. I know, and there's a local researcher who is looking at some of this related to menstruation, but very clear there's not been any link to, problems with fertility, anything that's long lasting. But, the goal of getting a vaccine is for your immune system to learn how to protect yourself against COVID, and your immune system can interface with your hormonal levels, et cetera. And so there is at least some biological plausibility that you could have some change in terms of a heavier period or a lighter period, for example, right after getting the vaccination. But still, I'm glad that people are looking at it, but I don't want people to feel like there's something dangerous about that. We've not detected anything concerning, safety concern for any of these vaccines, but I think it's highlighting just that we don't always ask these kinds of questions sometimes in the trials, and I think that's a good thing to highlight.
Yeah, you're right. John Shoeshirt from Facebook, is there a distinction between the safety of working out in a gym versus group classes?
So, not entirely sure exactly what that, so.
Probably working out by yourself. Just,
yeah, so okay, yes. So how do we get COVID? We get COVID from other people. Right? The risk of getting COVID from surfaces, very, very, very low. And this has been increasingly clear, right? I remember talking about this a year ago, that, the craziness of washing your groceries and all that is not the main thing you need to be focused on. The main thing you need to be focused on is the risk from living, breathing humans. That has not changed. Nothing about that has changed. So if you are in a gym setting, the concern, theoretical at least, is that if you are with other people and people are breathing hard, like they will do when they are exercising, there is more risk for potential COVID spread. So I would not have a lot of concern at all for people who are working out by themselves, even in a gym with shared equipment. Certainly, you could do the cleaning like you would, but you don't need to go crazy about it. The larger risk, as always, is people gathering in an enclosed space, especially if they're not fully vaccinated, and especially if they're not being really careful about wearing masks. So I hope that helps answer the question.
Okay. Here's a good one. Mike Chenander from Facebook. Can we schedule a second dose appointment via ZocDoc if we received a first dose elsewhere?
Yeah, and I know people are interested in this because people who have had some of this vaccination vacation, if you will, where people were, driving out of state. You can. And we are still encouraging people for a number of reasons to go to the place that they got their first dose appointment. If you got it at a doctor's office especially, we would like you to come back. We are sending vaccine in a way that makes it available second doses first. So we work pretty hard to make sure that we know how many first doses were given 3 weeks ago or 4 weeks ago, if it was Pfizer or Moderna, and we supply those settings with the appropriate number of second doses so that they can fulfill that. But we are allowing people to make second dose appointments, and all vaccine is reported into, just to be clear, into the state system. And so there's the possibility, we don't lose somebody's vaccine appointment if you get one in one place and one in the other. I worry a little bit about people not being as clear about which vaccine dose they got. Right. So that's the other reason why the best practice is to get your second dose with the same provider in the same place. That makes it for sure that there's an appointment for you, there's a vaccine for you, and it's the right vaccine, and that all the reporting will be done appropriately. But we are not turning people away who need to make a second dose appointment.
All right. That makes me think, though, about the vaccination card that you get, too, and how important that is.
That's right.
For people
bring your card. Yep. If you, say you come to one of the City of Chicago pods, you need to have, bring your vaccination card, because we will look, and it's got to say Pfizer on it, right? We're not going to give you a second dose of Pfizer if your first dose was Moderna, for example. And we'll want to look and see, is it the right time frame? We got to sort of do all of those checks on it. But yes, we are allowing people to make a second dose appointment if they traveled a long way, for example, to get that first dose.
All right. Denise?
And again, that's because we've got what? Availability.
More vaccine than we can handle.
We can handle it.
Well, we can handle it, yeah.
But yes. Enough.
Denise Sims from Facebook. My brother will understand that reference. Denise Sims from Facebook. The mayor mentioned the CTA buses for mobile vaccinations. What do you think about getting the mobile buses out in every community?
So that is another thing that we are very hopeful that J&J will come back for. So if we think about the Johnson & Johnson vaccine, 1 dose and done, it is perfect for settings that people decide to get vaccinated kind of spur of the moment, right? The whole point of the vaccination bus is there is no appointment, but there is some predictability in terms of when the bus may move through. We are also, just to kind of, we're not ready to do any of this just yet. We want to see what happens with vaccine and J&J, but think about other places where you need to wait or you are otherwise going, you know, laundromats, you know, the DMV, like the clerk's office, like places that people are already needing to go, particularly if they already need to wait. We are quite interested in, are there ways to bring vaccine into those settings and let people get vaccinated sort of in the course of their day. So we think that the bus is an example of something that will help that spur of the moment decision making. I would really prefer to do it with the 1 dose vaccine because it just gets, it's a lot harder. Yeah. And it's not just about the bus. It's about, you know, are we making consistently available COVID vaccine around the city? So people know, you know, every Saturday, every Tuesday, every Sunday, there are vaccine appointments available at this place near where I live all over the city. That will improve access. So yeah, we are continuing to work with CTA. We've got more of these buses getting repurposed, and we are intending for it to be a part of the campaign, but really hoping that Johnson & Johnson will come back and we'll be able to turn it on.
Yeah, and probably worth saying as we build the fleet, we are using data to help us make decisions about which communities to go to.
Absolutely. Yeah, and really with, you know, Protect Chicago Plus, as I think people know, this focus on, particularly as we moved into phase 2, into 1B, I mean, knowing where had COVID hit hard, where were there a lot of barriers to vaccine, things like people not having primary care, et cetera, lots of essential workers. As we have now moved into phase 2 in this full eligibility, you know, we're continuing support in those communities, but we are also very focused on the zip codes that are significantly under-vaccinated compared to the rest of the city. We're using a lot of those same approaches, and really, you know, huge thanks to the community-based organizations and the clinical providers and the faith leaders and, you know, everybody who is stepping up and coming up with really good creative ways to make sure that information and access are both getting out. But that is some of what we're moving. One other thing just on J&J, if folks don't mind. So we've gotten a fair number of homebound questions, I know. I don't know if you have one there. But the call center has now actually called through the entire list of people who had registered for a homebound vaccine. I'll put a little caveat, if you just registered online in the last few days, that might not apply to you, but anybody who, you know, registered a week or more ago, they've called everybody and they have actually booked everybody 4 appointments, and we've been using Pfizer in the interim here, before May 7th. So there are some people who didn't answer the phone, right? Who we've left voicemails for or just didn't answer. And I know sometimes people might not answer if they don't know. You know, that number, it comes from the call center, 312-746-4835. And so if you are still saying, I'm not sure if I got a call, we probably have tried to call you and miss you. So call the call center, 312-746-4835. That's an example. It's not the public vaccination bus, but we've put a ton of resources, and we've got volunteers from our Medical Reserve Corps and the Chicago Fire Department. Again, we've got vaccine, and we're putting a lot of resources to where it's most needed. So really excited to let folks know. I mean, that's pretty soon, and we've done a lot to make that happen. So that's exciting. Yeah, reach out if you know somebody who still needs to make that appointment.
All right, Chicago Vaccine PMO from Twitter. At CDC Gov shows Illinois with 9.3% of sequenced cases as the Brazilian P1 variant during the 4 weeks ending 3/27. Okay, so this is into the data almost a month ago. Highest percent in the U.S. Is this consistent with the city's variant surveillance? Any guidance?
Sure. So for people who may not be following it quite as closely, good question. So and you can look on the CDC, you can see all of the variants that are detected really across the country. There's been a lot of transparency on this. So here in Chicago and in Illinois, we track variants, and there are a lot of different kinds of variants. B117 is the one that is by far the most common. That's the one that originally emerged in the UK, and it makes people with COVID a little bit more contagious, if you will. That's sort of the layman's term for it. You don't need as much exposure to COVID to get sick from it. And so it outcompetes the traditional, the OG COVID virus, if you will, because it is more infectious, it spreads more easily. However, the good news is B117, absolutely no problem with any of the vaccines, not even a little bit of a decline. So that is the one here in Chicago, across Illinois, and across the US that we see the most. And we are up to, estimating probably around half of our cases here are one kind of variant or another. The P1 variant that the questioner is asking about is a much less common variant. It's the one that originally emerged in Brazil. And there's been some worries about it because in Brazil in particular, they saw another big surge of COVID in a setting that had been really hard hit the first time.
So reinfection.
Yeah, more concerns about reinfection. The vaccines, again, we can't say this enough, all three of the vaccines, including Johnson & Johnson, all three of them remain protective against all of the known variants. It's just that your protection level drops somewhat with some of these variants. Doesn't drop at all with B117, but it drops a little bit with some of the others. So what we've seen here in Chicago with the and to the questioner's point, the P1, although it's not the most common, we're seeing more of it here than we are in some other settings. We know from our investigations here in Chicago, and yes, that does reflect cases here in Chicago too, that they have been geographically dispersed across the city, meaning that they are not all linked to each other. There have been different introductions of this variant, and not in international travelers, at least not any more than the other variants. So it's not like someone flew in from Brazil. This is sort of a sign of continued transmission of COVID. We have seen spread of P1, just like we have the other variants, in the same way that traditional COVID spread. So we've seen spread in households, we've seen some spread in buildings, and really we've not seen at this point, interestingly, anything hugely concerning related to either reinfection or breakthrough cases. The epidemiologists continue to look at it, but it's not that we've seen all of these in people who previously had COVID or who had been vaccinated. So we continue to work a lot on it. The team has put together quite a bit of information related to variants. I think we've got some of it up online. If not, we can post it. But it's there. But again, what do we do about it? The same things we would do anyway. Get vaccinated first and foremost, and then continue to do the things, in public while our case levels remain high.
Masking and keeping our distance.
There you go.
Yeah, and it's also just pointing out that we are contact tracing.
We are. Yeah, we are really contact tracing, like a lot. With, cases under somewhat better control, our contact tracing team is fantastic. They're reaching out very quickly. They call, we do the full investigation. Like, we have a really, really robust contact tracing system at this point. And anytime, I mentioned this the other day, behind the scenes, anytime somebody has COVID, we're checking to see, per our records, did they have COVID in the past? Might this be a reinfection? We're also matching a COVID case to vaccination records. And if we're seeing the potential for breakthrough cases, those are cases we really want to do extra investigation on. Did people travel? Who were they in contact with? But also do that genetic sequencing. And we now have the capability. Like, this is really, one of the things from COVID is that there's been a lot of new investment in the more advanced laboratory work that we've really needed in public health for a long time. And so we have a contract. We're working with Rush University. We've been doing some hiring ourselves within the health department to really get some expertise. And we can then so much better answer these questions of how are the variants spreading? What are the risk factors? But it's new that we've had that here in Chicago, and important, and something that we'll be able to use long past COVID.
And it's so exciting. I know we're out of time, but I do want to lift up this collaboration and partnership between community-based organizations that have hired these contact tracers, between providers, big hospitals like Rush and the public health department. I think that's another just wonderful outcome of this terrible pandemic.
Absolutely. Absolutely. It's been one of the best ones. So,
all right. Any good news?
I think one piece of good news is that there is now. Nobody asked a question about this, but there are now at-home COVID tests that are rapid and on the spot. You can get them at Walgreens, CVS, or Walmart. They are the Abbott Binax Now test, which is a rapid antigen test that's used all over the country. But the FDA just gave that emergency use authorization so that you can get tested at home. You can buy them at the pharmacy. You can also buy them online. You don't need a prescription. You don't need to send it to a lab. It's a 15-minute test, and it's approved for use in children as young as 2 if an adult is doing the collection. The collection is it's not the deep nose swab. It's a nose swab, but just in the sort of front part of your nose here. And each kit is $23.99. I was going
to ask the price point.
$23.99, and it comes with 2 tests. And actually, the recommendation is that you would do 2 tests within a 3-day period, at least 36 hours apart. But it's approved for people who do not have symptoms or who have symptoms, and really exciting to have a test that now has the full availability. There's another one too that was just recently approved. That one's a little more expensive, but broadly, this is I recognize that may not be affordable for everybody, but for many people, this is much cheaper than what has been available and much easier in terms of not even needing to send sort of into the lab. So,
if you have health care, does it cover it?
Insurance, you mean?
Yeah.
I don't know the answer to that. Certainly, if you have a FSA, you can submit the cost to that. I know that for a fact. I'm not sure. Like, this is an over-the-counter product at this point. So I think it would probably more be something that you would probably pay for or use your health savings account for. And as a reminder, you can continue to get free testing, like, to be very clear.
That's true.
You can get free testing. You can get free testing through your doctor. You can get free testing through the city. I think this is really meant to sort of be more of a convenience for people, a supplement. And, we're going to see. I think this is just the dawn of really having COVID tests available. It's a big deal to have this available. Hopefully costs will continue to come down. We certainly are interested in supplementing, access to this sort of work, but we do want to make sure if somebody has a positive COVID test, they are then reaching out to a healthcare provider. So there's a lot of pieces with it, but if you're interested, you can Google the Abbott Binax Now, and there's directions on how to use it, and it's exciting. It's a big step in terms of testing. So.
All right. And then the other good news is that we have vaccine.
Yes.
We have appointments.
There's so much good news. I have a list of 10 things of good news, but the fact that we actually have enough vaccine cannot be overstated in terms of how good news that is for Chicago. And I want you to tell everybody that so that we can really, really, really use this vaccine, get folks vaccinated, and get Chicago past COVID. All right.
So we're back here on Tuesday?
We're back here on Tuesday. Our list of good news just keeps growing, so we'll have more of it there. It is National Volunteer Week too, so thanks to everybody who has volunteered to help with the COVID response. It numbers in the thousands here across Chicago, and you've really gotten us this far.
All right.
All right.
Thank you. Do all the things that continue to protect Chicago.
Absolutely. We'll see you next week.